Good afternoon, everyone. I see we have about maybe half the folks who are signed up here so far. So I'm just going to give everyone another minute or two to get logged on, and then we'll go ahead and get started. Thank you. Well, everyone's just in another minute or so, and then we'll get started. Looks like most everyone's here. Okay, good afternoon, everyone. We'll go ahead and get started. For those of you who have not been on our webinars before or don't know me, my name is Jack Kavanaugh. I'm our Director of Training and Program Development. So Mentor New York is the New York State affiliate of a national network of organizations. Mentor, the National Mentoring Partnership, is our national organization. So we serve programs throughout New York State. We have offices at our headquarters in New York City, as well as an office on Long Island and an office in Buffalo here in Western New York, which is the office that I'm based out of. My background is in social work. I've worked in youth development and mentoring programs for the better part of the last 15 years or so. And so hopefully we can offer some insights for all of you. So as we talk a bit about this, I do want to let people know that you are more than welcome to put some questions into the question box at any point. I might answer some at the end. I'll try to kind of keep an eye on it to make sure that I can try to answer some as we go, but feel free to throw some in there at any point. But we'll have time at the end specifically for questions as well. So we'll get started. So for those of you who have been on these webinars before, we've been doing them pretty much every Wednesday for the past few months. We try to keep them relatively high level, and to the point. I want to keep them relatively general to try to speak to as many different programs as possible, because we have a really large number of programs that attend these webinars, as well as who do a lot of different types of work. So that said, if you have specific questions that may make it more helpful for you, please feel free to ask. Or you can always reach out to us afterwards and we can answer some questions that are maybe a bit more specific to your work. So today we're going to be talking a bit about trauma, understanding trauma, and how mentoring can impact young people who are experiencing or have experienced trauma. So we'll start with this quote: "Traumatic events are extraordinary, not because they occur rarely, but rather because they overwhelm the ordinary human adaptations to life." And I think this is a really an important point, because we want to think of like really defining what is trauma. And instead of thinking of trauma as something that just, again, happens rarely, because the reality is more people than I think we like to think are impacted by trauma on a daily basis. But the reality of the way trauma is functions and the way it impacts the brain is more in terms of how it shatters the expectations and coping skills that we've developed to deal with the world, right? So different people can go through different experience or the same experiences and come out on the other side where one person was traumatized by it, but the other person was not. And so it's not about the event, but it's about the way in which our brain and our ourselves interpret and code the event in our brain. And so we're going to talk more about that in a little bit. So again, how do we define trauma? So individual trauma results from an event, a series of events, or a set of circumstances that are experienced as physically or emotionally harmful or threatening. So it could be a one-time thing, it could be a series of things. I think it's important to think about it as a series of events as well, because sometimes it's easy to think of trauma as being specifically about like some major incident, like a car crash or an assault or something like that. We think of it as like the psychological equivalent of like a stab wound. Like it's a one-time thing that happens and then we kind of slowly heal. But the reality of the way that trauma functions a lot for young people is that it really is more like being stuck in a small room that is slowly filling with water, and you just never really know when your last breath is going to come. That constant stress and anxiety, where your stress hormones are just constantly pumping in your brain, because you don't know if you're going to have a safe place to sleep tonight. You're not sure where your next meal is going to come from. You're not sure if there's going to be some violence in your home tonight, or if you're going to get home and you have a parent who's actively in the throes of addiction and is going to be passed out on the couch, or dealing with overdoses. All of these different things. It's just the constant stress of not knowing, that lack of security. And so we think about young people as dealing with trauma. Again, it can be really tempting to just think of it solely in those terms of some major event, like someone who was sexually assaulted or was in a car accident. But that's just not really the way it functions in practice. And so again, thinking of the series of events or set of circumstances, and thinking of the ways that living in poverty itself, can add on to and exacerbate trauma. Second, trauma has lasting adverse effects on an individual's functioning and well-being. And we'll talk more about that in a little bit. And lastly, determined by the person who's having the experience. So the person who goes through the experience, they're the ones who decide or are able to articulate whether or not this was something that was traumatic or not. Two people can have the same experience it and process it in two completely different ways. And so it's really important to remember that when we're dealing with young people dealing with trauma, right? If they come to us and are saying, we dealt with this experience, and I'm dealing with this traumatic experience that I had, or I was reading about the impact of trauma and it sounds like what happened to me, or sounds like, I see myself in that. We want to believe them. We want to, yeah, we want to believe them. And again, I just don't want to get too ahead of myself. We'll talk more about why that's important later on as well. So a couple different forms of trauma. So first is primary trauma. So that's trauma that directly impacts an individual. So this is what we would commonly think of as trauma when we talk about it. Again, that existence, that the set of circumstances of living in poverty, or food insecurity, or dealing with homelessness, or family members with addiction, poverty, all of these things. The person who's actually dealing with it, that's the primary trauma. Secondary trauma, or sometimes called vicarious trauma, is also really important to talk about for people like us who are working with young people, both who have experienced maybe some higher levels of trauma ourselves or not. But that's when you're hearing that narrative of someone else's traumatic experience, and it brings up things for you. And so that can either be triggering some sort of past traumas of your own experience, or creating sort of these new pathways of stress and trauma in your brain of just hearing about someone else's experience. So one of the examples I use for this with my own experience was when I was doing my graduate work. One of my social work field work placements was at a cancer hospital, and it was working there, and part of the job was sitting there and talking to people and their families about what they're going through, helping them talk through the experience, and sometimes that was talking about hospice care, end of life care, things like that, and sometimes it was they just got diagnosed in their hospital for their first round of chemo. And I always found that the people who had just recently been diagnosed were the ones that were most impactful on me, or the ones that strained me the most. And I just remember, like, I would be talking to these people about 2 days ago they thought they had the flu. They went to the doctor. The doctor's like, you need to get to the hospital right now. And today they're sitting there saying, you got to decide between chemotherapy or hospice care. And it's like 2 days ago, I just thought I had like a little bit of a flu with some body aches. And that would happen. And so, I would kind of deal with this stuff, and it started impacting, be like walking home after work, and just thinking about it. And, all of a sudden I'd have these like aches in my body, and I'd be like calling my doctor, like, I got to get this looked at. I got to get this looked at. It caused a lot of stress. And so that's an example of the way that, secondary and vicarious trauma can, impact us. I was not the one who was dealing with having cancer, but I had to hear about their own experiences and someone else's experiences, and it had a deep impact on me. And lastly is, shared trauma or collective trauma. So that's when two or more individuals experience the same thing. So that can be on a kind of a group scale. So for example, survivors of some sort of natural disaster. So for example, a lot of this came up during like Hurricane Katrina was a big one. There was a lot of folks who were going through a lot of trauma around that time, and people who were dealing with it, collectively. There's, hundreds, if not thousands, of people who are going through similar, if not the same things, or, survivors of a car crash. This could happen. But it also could be on a societal level. So for example, I would think that right now what a lot of us are going through, trying to live through a pandemic, is an example of all of us dealing with some sort of collective trauma, right? For many of us, the current circumstances have just overwhelmed all of our coping skills that we've developed for our life, because this is just not something that we ever thought we'd have to deal with, or we were not equipped or prepared to deal with. Similarly, a lot of the things that are happening around, protests against police violence and racial justice, and that being center of attention for a lot of people, is bringing up for a lot of people who've had their own interactions with police officers, or whatever that looks like, seeing, these videos and headlines all over the news, and so many people are sharing in that collective trauma right now as well. And so you can kind of see it on that macro level. So it really runs that spectrum. So all of these things are things we want to make sure we're considering when we're thinking about how trauma impacts, our programming, because it's not just our mentees and our young people, it's also the mentors, the staff, ourselves, all of that. So we'll take a step back and talk a bit about some of the neurobiology of trauma. I'm not a scientist or a doctor or a neurobiologist, so I don't want to go too in depth on this, but I do think it's important to highlight for a few reasons. So here's an image that they took of someone who I I should like try to see if I can get a newer image because I don't like the way they call this a healthy brain and an abused brain. I think that's not super awesome language, but you get the idea. So on one side, they took a scan of someone who had experienced a higher level of trauma and someone who has not. It was from, it says in here is the brain of a Romanian orphan institutionalized shortly after birth. And so you can really see the impact that a lot of these, that neglect and abuse at a very, very early age can have on your brain's ability to function. And so I bring this up and use this picture for two reasons. One, that you can see that there's a scientific biological impact that trauma has. I think sometimes we talk about it psychologically and we forget that, psychology and um, psychiatry and mental health is really just a way of talking about the way that, these types of physical manifestations in our brain manifest in the external world, right? So it's important to look at these pictures and say, okay, I see that there's a literal physical difference between someone who experienced trauma and neglect at a young age and someone who didn't. And the second thing is that where it impacts is mostly on our ability and the parts of our brain that form memories. That's the temporal lobes. So that's the part of our brains that are most involved with memory formation and things like that. Because when we are dealing with a traumatic experience, that's the part of our brain that is most affected, right? Because our brain codes and interprets the experiences we have and then files them away where they need to go. And so, for example, if I'm driving on the highway in the left lane, um, and there's a car on the right, and I'm trying to pass them, they don't see me. They try to change lanes. They hit my car. I get in a car accident. My brain is going to codify that experience of me driving down the street on the left lane of the highway with the car on my right as like negative and bad. So the next time I'm, trying to do that or even get on the highway, my brain's gonna be yelling at me like, "This is a dangerous thing. You need to stop doing this. Like, please don't do this. We've been here. This was bad. This was a lot of pain." Um, and that's what that triggering looks like, right? And so the part of our brains that gets really, really impacted by a lot of this is again the part that's mostly related to memory, and that's when we talk about triggering, especially that's something that it's important to think about and remember that it's really about how our brain coded certain information to signify that this is a bad thing. It could be a smell, it could be a certain color, it could be anything. So most of the research around trauma and how it impacts us as humans really started in the early 90s with the adverse childhood experiences study. So some of you may know this, some of you may not. That's okay either way. We're going to talk about it briefly. And so what they really wanted to do with this study is it was an HMO, so it was Kaiser Permanente in California. This was in the early 90s. So what they did was they took over 17,000 of the HMO members who were coming during their like routine physical exams. They would ask them a set of questions about their childhood experiences, and then as well as their current health status and current health behaviors. Um, and so this has been something that's been continued and replicated in a lot of different ways since then. But the original one was in the 90s. And so what they wanted to do was see where these sort of adverse childhood experiences, so if someone had experienced any number of them, correlated with physical health outcomes later in life. I'm gonna go to the next slide and come back to this one. Oh, there's a slide missing. That's why. Okay, give me 1 second. I'm gonna Google this. You guys can see really quick. So of the ACEs, this is the image that's on the slide. That should be there. Of the ACEs, a little better. Here we go. The beauty of screen sharing. So of our ACEs, you can see that there's a number of things. So there's 9 childhood experiences. So what they did was they would ask them if they experienced each of these as a child, and they would give you an ACE score, which was from 1 to 9 for how many you had. So it's physical, emotional, or sexual abuse, physical or emotional neglect, and then as well as household dysfunction. So that's mental illness in the household, incarcerated relative in the household, mother treated violently, substance abuse in the household, or divorce. And they found three major kind of conclusions, I guess you could say, or observations or patterns, I guess is probably the better way to say it, of the results. The first was they tend to cluster, right? So you'll see someone that has a score of maybe 0 or 1 or 2, or someone who has one of like 6, 7, 8, but rarely would you see them kind of in the middle. And I think that kind of makes sense if you think about it. They tend to, there's a lot of overlap and intersection that happens with all of these, right? So if you think about, one thing we know about folks with mental illness is that at a very high rate, folks with mental illness tend to self-medicate and, have issues with substance abuse as well. There's a high correlation between those two. If someone is using substances, there's a high probability that they may end up incarcerated at some point. If you have one incarcerated relative, one incarcerated parent puts a lot of strain on a relationship, that might end up with divorce. You have a single parent who's working to raise, multiple kids. They can't always provide what's at home. And then you might end up with some, physical or emotional neglect. All of these different things, just you can see how they start to pile on top of each other. So if you have one that leads to two, that leads to 3 or 4 of them, it's going to quickly accelerate into being quite a few. So that was one. The second one was that they happen at a much higher rate than they had previously thought. So for a lot of these 17,000 people, just the sheer number of them who had experienced any level of these things was just much, much higher than they had anticipated. And most of the people that they were part of this original study where, middle to upper class, predominantly white professionals, which did not really fit with the stereotypes and assumptions that these, social scientists and health professionals may have been making, in the early 90s, although probably still today as well, that they would have these types of experiences as well, which, now we know that that's not always true. But the third thing was that there was a clear correlation between higher numbers of, traumatic experiences as a child and poor health, physical health outcomes as an adult. So let's go back to this. So you can see on this graph that as the ACE scores go up, the risk for negative health and well-being outcomes also goes up. So that's things like obesity, diabetes, depression, heart disease, behaviors like smoking, alcohol and drug abuse, lower graduation rates, lost time from work, academic achievement, all of these things that have a really strong correlation with a higher level ACE scores, to the point where they call it dose response relationship, which is just a very strong correlation. And so, so we talk about all that to kind of explain the what, right? The what. That we have young people who are dealing with high levels of trauma. We have young people who are dealing with poverty. We have young people that are dealing with racism. We have young people who are dealing with, family members struggling with addiction or homelessness or divorce or, various types of neglect in the household, all sorts of things that the young people are constantly dealing with. And so when we, as people who are working with young people as mentors or as professionals, and this is these are I think it's also important too to remember that we talk about young people, but children with trauma grow up to be adults with trauma, and so it's not like when they turn 18 these things just disappear. And so if we're dealing with our mentors, or we're dealing with staff, or we're dealing with a mentoring program that mentors young professionals or really anyone. These are not things that are specific or dynamics that are specific to working with young people. And so I think that's another thing that's important to remember, right? That young people and children with trauma grow up to be adolescents with trauma, grow up to be young adults with trauma, who grow up to be adults with trauma. These things don't just go away. And so, as we're talking through this, thinking about how this can be relevant both for the young people that you serve, as well as the mentors and staff that you employ, is going to be really helpful. So let's talk about so trauma-informed care, right? So we talked about the what, but now let's talk about, okay, so what do we do, right? We've talked about how trauma is a very pervasive part of the human experience, particularly for those of us who work with vulnerable populations in different communities. Um, so what do we do? So trauma-informed care has been a sort of, I don't know, what's the word? Increasingly popular approach to modeling and shifting around our work to best meet the needs of young people. And so there's a couple key principles that we have to take into account when we're thinking about trauma-informed care. The first is safety. Second is trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice, and choice, and an understanding of cultural, historical, and gender issues. Oh, getting ahead of myself again. So let's talk through these quickly. So safety is exactly what it sounds like. It's the baseline. I think it's what most people think of when they think about how do we help and build programs that address trauma. Is we want young people to be, we want to create spaces where people can come and be their whole selves and feel safe to do that, right? We want to create communities, spaces, community centers, after school programs, schools, relationships where young people and mentees can feel safe and supported. And so that's the baseline, right? Like, what are we doing to create safety? So that can look like, I think that really starts with making sure that mentors are adequately, trained on, these types of principles that understand the issues and the things that communities deal with. Because if you have that base knowledge, if I know that these are things that exist in the world, right, I might have people who are more comfortable talking to me then about them because they don't have to educate me. They can actually just have a conversation about it, right? And that's really important. Second one is trustworthiness and transparency. I think this one's really important, and it's really simple, and yet I think adults struggle with it in our relationships with young people sometimes. But for me, like, this is really as simple as just say I'm going to do something, and then do it. Like, hey, we're going to meet on Friday at 3 o'clock, and you actually meet up, right? And so we want to make sure that there's that consistency and that trustworthiness, that we're talking to people. Some of this intertwines a bit with empowerment, voice, and choice, right? Like allowing young people to have, be able to make decisions about themselves. But even when you can't, that transparency around what you're doing is really important, right? Don't just rely on power to get people to do what you want or get the young people to do what you want, but really explaining to them, like, listen, this is really why we're doing this decision. We're moving the program in this direction. I hope you can, appreciate that, or this is for this specific reason. And start, opening up your decision-making processes about things to them. The third one is peer support. Particularly when we think about the difference between, we talked earlier about, someone who two people who go through the same experience and one person might come out traumatized or not. I think one of the big things that you'll find with young people is that one of the major kind of factors on that fork in the road, so to speak, is peer support, right? Because if we understand that other young people are dealing with what they're dealing with, then they won't feel that shame. They won't internalize that shame, and they'll be able to, develop and hear new coping skills. So, for example, if you have like a young person who's dealing with, like they lost their apartment, they're currently trying to like staying on different family members and friends' couches, and they're really embarrassed about it. They're coming to school a little bit dirty. Whatever it is, they don't want to talk to you about it. And if you have other young people who are able to say, listen, like I dealt with the same thing, it happens, here's what helped me, and being able to like kind of normalize and help them cope with that experience is going to help them not codify that as this horrific traumatic experience, right? That reduction of shame is really important, and it happens a lot in that peer support. And there's one thing when like an adult or a mentor says like, hey, you shouldn't be ashamed of that, like it happens, like let's, I can support you. But it's a whole nother thing when they hear that from their peers, right? Just the power of that peer support can be really, really crucial. Fourth, collaboration and mutuality. Exactly what it sounds like, just involving young people when you're developing your programming, when you're developing things. And this can be on a micro and a macro level, right? The micro level is just And some of this also blurs in with the empowerment, voice, and choice, but just allowing them into those spaces where we're making the rooms where decisions are made. And so sometimes that's just like, hey, what game do you want to play today? Or where do you want to go on a walk? Or, whatever it is. Or like, what time do you want to meet? What works for you? We don't want to building our programs and structures around what's easiest and best for the adults and not always the young people is an example of when this doesn't happen. And so, but that can also be on a higher level where it's having people in the room with, where our board is making financial decisions about an organization, or, we're having staff meetings and policy meetings about the things that we're going to see, or, are young people, are you giving them, allowing space for them to give you feedback on what your application process is like, or, in your program evaluation procedures, do you have a survey where you're collecting qualitative data around what young people value and experience, things like that. And so you want to make sure we're really doing this because, again, we want to create more spaces where young people feel ownership, where they're able to come in and feel like they have a stake in the space where they exist. And sometimes it's a physical space, but when I say space, I also mean, a relationship, relationship in the space that we create in those mentoring relationships. And the last one is cultural, historical, gender issues, which we're going to talk about in a minute. But first, I also want to talk about this. So again, we have those principles, but what does it look like, right? What does it actually look like in practice? And so that's where these 4 R's really come in. That's that realize, recognize, respond, and resist. So first, we realize the widespread impact of trauma and understand potential paths for recovery. So that's coming and hearing someone talk like me about this right now in this webinar. That's training your staff, which we are capable and able to come in and do, about the widespread impact of trauma and what potential paths for recovery look like. Right? We talked about those how widespread it is, and then we're talking now about, okay, well, what do we do about it? We're going to talk more about what mentors can do in a second. The second one is we recognize the signs and symptoms of trauma in clients, families, staff. Right? So we've realized that it's everywhere. We start to get a sense of what it looks like in that sort of abstract academic sense. But then we start to recognize it in the people around us, right? Our clients, families, the people that we serve, as well as the staff that we oversee, all of these different things, and the people that are directly around us. So we've realized that it exists, and then we start recognizing it exists in the communities and spaces that we operate in. And then we respond by fully integrating that knowledge about trauma, right? All these things that we've done into our policies, our procedures, and our best practices. So we realize, recognize, and then respond. And then we resist. We resist that re-traumatization. We resist it of children, as well as all the adults who care for them. So again, not just the mentees and the young people that we serve, as well as the volunteers, our staff, ourselves, and all of the trauma that we bring to the table. We want to make sure that we're not re-traumatizing those around us. And then culture, humility, and sensitivity. So a lot of people use different language to talk about these types of things. I think it's important that we talk about them in terms of, I think cultural humility is a better phrase to use than things like cultural competence or things like that. Because it's an ongoing process. Cultural competence implies that at a certain point I'm competent, like I'm good, like I don't got to keep worrying about it anymore. I think humility is a better way to think about it because the idea is to decenter ourselves and our own cultural senses of cultural superiority, because that's what we do as as humans, right? Our natural instinct is to prioritize and think the way we see the world is the way that everyone sees the world. We center our own experiences. And I think that's a normal thing for humans to do, but we have to make sure, especially if we're talking about it from a trauma perspective, that we start to shift away from that. And so it starts with that awareness that cultural differences and similarities between people exist, right? And it's just acknowledging that folks from different cultures, and that can be based on race, ethnicity, all sorts of different characteristics that impact our own sort of cultural upbringing, gender, sexual orientation, all of these different pieces. Where we're from, like I'm from the culture of living in Buffalo, New York is certainly different than the culture of living in, my friends that live in like Brooklyn. They're just very different communities, right? And so there's just cultural differences. as well as similarities. But when we start thinking about it from a place of that it's not a hierarchy, it's just, they're just different. And that's when that culture of humility starts to come into play, that we understand that there's not a hierarchical definition of, this cultural experience is more or less valid than this other cultural experience. And so then you actively are moving past those stereotypes and biases, right? Based on race, ethnicity, sexual orientation, age, religion, gender identity, geography, whatever it is, right? There's differences that exist, but then we move past the stereotypes and biases around those differences and start recognizing them for what they are. And so we look at then the importance of addressing historical trauma, right? And so generational trauma. So those are those things that maybe impacted folks a generation or two behind us, older than us, but also impact us. So we may not have experienced things that they've experienced, but it still impacts our lives. And so there's some evidence that some of this happens biologically. I'm not a scientist, so I'm not going to go into that, but I definitely have seen it and seen research on it, how it impacts, how it plays out socially and relationally. So for example, I was raised Jewish, and so I have family members a couple generations back that were in the Holocaust, and that is not something that I've had to deal with in my personal life, but it is something that their experience of having going through that has impacted the way that they have seen themselves and their Jewish identity, which then impacts my parents' Jewish identity and then mine. And something like I'm trying to think of an example. So like wearing a shirt or a necklace that had a Star of David on it, to them is, something that should be hidden away because they were, raised in a time when that was not something you would advertise. And so now that's kind of shifted, where it is something that's a bit safer to advertise. But when they see it, they still start to be like, hey, you don't do that. And so when I was a kid, they kind of taught us you don't show that, right? And so that's one of the ways that generational historical trauma gets passed down through generations. So the last piece is really, how do we support young people? So there's a lot of words on this slide. We're going to talk through them. But the first one is context and roles. So making sure that that mentors have a very clear and defined role. When you're dealing with young people who are dealing with trauma, it can be very overwhelming for people who are not adequately equipped or prepared to have those conversations. And so one of the things that happens a lot is, mentors or, whoever will get disclosed and someone will talk about some, trauma they've experienced, and it'll be really overwhelming. And so they'll just kind of shut down, not be able to deal with it, because they feel like if I'm going to open this door at all, I have to be prepared to do everything. Like I have to be the one to they just feel like they have to do everything. And so when the roles are really clear about what is expected, what's not expected between the people who are here. So you as the mentor, you're not expected to do, trauma counseling to help them come to terms with the sexual assault they dealt with 2 years ago, right? That's not their role. And so making sure we, are clearly defining that for mentors and understanding that their role is very limited, and then making sure they're trained to do that, right? Doing that homework around what does that look like? And making sure you know yourself too. What sort of triggers and dynamics are things that you need to avoid or should be at least cognizant of. By and large, folks who go into helping professions, and I think folks who go into mentoring and volunteering with young people as well, have higher rates of trauma than the general population. And so something we have to remember too, that it's more likely than not, if it's more likely than not that the people that we're interacting day to day in the world have experienced trauma, then it's even more likely than not that the people we're working with in our professional lives have, if we're working with people who are volunteering to mentor or, work in helping professions. So thinking about those effective conversations, so acknowledging what's going on and be understanding and conscientious. So making sure we just, say what it is, call it what it is, and be understanding and really start the conversation. A lot of times these things will pop up and there'll be like a big elephant in the room where like mentee doesn't really want to mention it, the mentor doesn't really want to mention it, but we both kind of know what's going on. So, call the elephant in the room out, begin that conversation. Acknowledge those emotional reactions and offer help. Avoid harmful messages. Understanding different ways emotions may be expressed. Again, someone's traumatic processing of whatever happened to them is going to manifest differently for some people than others, and that's okay. Ask questions about safety. Make sure you give folks time. Like, these are not things that are going to change or shift overnight. And make sure you give it time and advocate when necessary. Lastly, create connections for greater impact. So more than anything, we want to make sure we're providing young people with strong, supportive relationships. Deepen your support and impact, making sure you're deepening that as much as possible. Engaging with organizations that are equipped to facilitate safe, healing, and productive conversations. So again, part of that role is knowing the boundaries of where that mentor shouldn't be, like, crossing into that realm of, like, therapy, or talking about, I don't know, every program is different where those boundaries are. But making sure that, we don't want to just say, like, here's the boundary you don't cross, and then, we're going to leave those young people stranded on the other side. We want to give them connections to other spaces in the community. And so even if the mentor isn't equipped to know all that, but at least knowing, like, where are those organizations in your community that deal with, young people? Are they seeing trauma therapists? Can we refer them somewhere else? Do we know where some of the trained mental health professionals are that do, like, teen groups and things like that? We want to make sure that we know where those places are. And then on a macro level, empowering young people to set the agenda for community conversations. So we talked about, that empowerment, that voice, that choice, but that's going to happen at a higher level too. So if we're talking about, gun violence in communities, then we want young people to be there leading those conversations about gun violence in their communities. If we're talking about advocating for racial justice and, police violence, then we want to make sure that young people set the agenda for those conversations as well, because today's young people are going to be tomorrow's adults who are going to still be dealing with this. Another thing that can be really helpful is mindfulness. So mindfulness is a great set of techniques that might be familiar, might be not. Um, that can really help folks stay grounded. So coaching mentors and mentees on, some basic mindfulness techniques that can work on together can be really helpful. This is one. So it's a 5 sense exercise. You sit down or lay down, close your eyes, and begin to focus on each of your 5 senses in this kind of imaginary safe space, right? What do you see? How does it feel? Is there a sound associated? Is there a scent that comes to mind? Start to notice all of these things and feel relaxed and calm, and then take that deep breath. It's similar to some sort of guided meditation, but for mindfulness specifically, is really focused on sensory experiences, being centered in our body, things like that. Another one that can be really useful, I think I found, for folks especially who struggle a lot with anxiety and things like that, is around progressive muscle relaxation. And so progressive muscle relaxation, you can find ones on YouTube. I've used apps on, like, my phone, and had young people that I've worked with, do that way. But it's a guided meditation basically, but you tense up and then relax different parts of your body, and it goes through, and it's kind of it's a very relaxing experience. But again, a lot of that mindfulness is drawing those deep connections between mind and body, and staying, centered and present. So, specifically, I think one of the things that's happening right now is our current, health pandemic, and thinking about how do we address our current health crisis with our mentees. So a few things that we can do with mentors and coach our mentors on is follow all the latest information on the CDC website, making sure that we're, you know, stopping any misinformation, making sure we're, communicating reliable information and well-sourced information as well. I think there's, in times of high stress, particularly right now when, everyone's kind of itching and anxious to have this all be over and done with, it's really tempting to fall prey to misinformation that's going to just tell us what we want to hear. And we want to, make sure we're avoiding that. But, again, acknowledging what's going on and talk about it, right? We want to acknowledge the elephant in the room. We know what's happening. They know what's happening. Let's have a conversation about it. We can't just, like, pretend with young people that nothing's going on right now. So we have to make sure we're discussing it, right? Take away that shame. What emotions or feelings are they dealing with? right? And give yourself the space and compassion to understand and honor the range of emotions that you and the mentee are going to experience. So mentors, mentees, everyone is experiencing this pandemic together. And so again, we want to take away the power of that shame. We want to take away the power of that ability for yeah. So we want to make sure that as the mentor in the relationship, we're providing that safe space and equitable space to process these things out in a way that's safe and productive and healthy. Another thing to think about too, so we talked about this a lot in other webinars we've been on, but the Search Institute talks specifically around their developmental relationships framework, which is identified 5 things that young people need from adults in their lives in order to fully develop. And that's adults who express care, provide support, challenge growth, share power, and expand possibilities. So during this time, what is it that young people really need from their mentors? So they need mentors who express care. They need mentors who provide support. Do they need mentors who share power, challenge growth? What is it that they need from us right now? We don't have to provide all 5, but we can at least focus on providing 1 or 2. And that's going to help us build and leverage these mentoring relationships to help, again, make sure that the current pandemic that we're all experiencing hopefully is not coded or as processed as such a traumatic experience that could be potentially. And also knowing that self-care is really important. You want to commit to self-care. You want to make sure we're taking care of ourselves. It's okay to take away from the news and discussions as needed to manage anxiety or other responses to the situation. I know, I'll just find myself on, the New York Times website or on Twitter or something, just reading everything, and it's just very overwhelming. And sometimes I just have to, stick my, all of that away. Be in it together. So let the mentees know that we're all in this together. We're here to help. And then be communicative, right? Those healthy and supportive relationships are just so crucial right now. And that's really important. So creating a plan about how you'll stay in touch and follow appropriate guidelines. What is available, what's not, making sure there's a plan around, how often you're going to be checking in or not, or, I think most programs have been able to do this by now, but making sure that it's really, continues, right? We want to create that sense of consistency of support. Being mindful of young people who are dealing with may have lost loved ones already and might have things that are being triggered for them. And let your mentee know that you see them and are there for them. And then again, being intentional about preserving that continuity, right? We don't want mentors and these relationships to fall off. I think they'll look different, and that part of what those relationships look like is going to be renegotiated to a certain extent, but that doesn't mean that they shouldn't be abandoned. Okay, so I'll open up the last few minutes for questions. You can type them in the little question box. I see a few people have already, so I'm going to read those in a second. If you have any other questions, please put them in. And while we're doing that, if you wouldn't mind doing a quick survey, you can pull up the camera on your phone and point it at this little QR code, and it should pop up with a link to a SurveyMonkey website, and you'll be able to take a quick survey. It shouldn't take more than a few minutes. And then sometime by the end of the week, you'll get an email that'll include all of the slides, as well as a link to this is being recorded, as well as some additional resources and links to some information that we have as well. All right, let's see. All right, so the first question, how would you recommend communicating to a mentor that a mentee has experienced trauma? I don't know that I would recommend necessarily disclosing any of that on our level. I think we want to make sure that there's space for the mentee to understand that this is a space where they can. If it's going to have a really specific impact on the relationship, then you might want to think about how you want to disclose that. But I think by and large, unless there's something that's, has the potential for major harm or particular, I don't know, like particular dangers to arise, then I don't think there's much of a reason to um, tell the mentor much more than you need to, because I think, we want to make sure that the mentee feels empowered. But I would also maybe recommend, before disclosing anything to mentors, talking to the parents or guardians or family members about what they think that young people could most benefit from, and making sure that's part of it, and including them in that conversation. So I guess, yeah, I would err on the side of not just, having a sheet of paper with the mentor that says, hey, just so you know, um, they they're dealing with their, parents' addiction at home right now. It's just, we want to let the mentee feel like it's their thing to share, right? That's part of that empowerment, is us not taking that away from them. Obviously, there's some things like, for example, I've been in programs where we've had young people who had experienced some type of sexual assault, and we did mention that to the mentors, so they would be aware and cognizant of, particularly physical boundaries, right? Like, making sure that they weren't making physical contact as much or anything like that. But that was a very specific circumstance, and so I think generally, you know, unless there's a really specific reason why you would, I wouldn't think you would want to. Okay. Would you recommend speaking with mentee's parent guardian prior to engaging in conversation about the pandemic to ensure communicating the same thing, supporting the parent's perspective? I'm not going to opine too much on this, just because, I want to say focus on some of the trauma stuff. I think part of it, though, is looking at. I think you have to have some sort of programmatic, you know, I think there's a limit to that. I mean, I think there are things like, for example, when we're talking to young people about sexual health, those are things that we not necessarily want to be able to provide. Our program is not about providing education on sexual health. So that's a boundary that we're just not going to cross, and we're going to engage with parents around that. On the other hand, we also don't want to be, we want to make sure we have our own set procedures around things. So we want to make sure that we also don't want to we don't want to end up on the other side where we're spreading misinformation just because a parent thinks that that's the truth, right? And I think that's the kind of danger that we run into. So I think by and large, what's probably more helpful to do then is have a really clear programmatic guideline of these are the messages that we are prepared to send, and letting parents know, and taking it from there. I think that would probably be a better way to do it. And that is, again, the same thing I'd tell someone if they were talking about how do we touch and broach a lot of tricky subject with young people, right? Understanding that, our program is not about addressing these concerns. So we're not going to spend a whole lot of time trying to educate our young people on sexual health and drug abuse, because we're not a sexual health and drug abuse focused program. But we are going to have some consistent messages, and then we're going to point them to other resources. And so making sure that, we're sending them to, the CDC website, things like that can be really helpful. And so the last two questions on here are variations on the theme. There's actually a few, which is just resources and best way to train and introduce mentors to this topic, or train mentors who haven't experienced much trauma to explain them. I mean, the best thing is training. There's some great online resources. So the University of Buffalo School of Social Work has an Institute on Trauma-Informed Care that has a lot of really great resources that I think is going to be really helpful for folks. I'll include a link to that in our follow-up email. But we are always available ourselves to come in and do some trainings. I think the biggest thing is to just talk about it and let them know that it's there. I think can be difficult conversations, and the best way to approach difficult conversations, I think, is to just have them and to say, we're going to talk about this, and we're going to talk about this in a way that's, creating that space that's supportive to do it. But, we don't want to shy away from it. I think sometimes I hear people say things like, oh, well, I don't want to make them uncomfortable, or I don't want to, push too much on them, or I don't know, whatever, something along those lines. And I can't help but hear that that's more of a concern of our own discomfort, right? They're like, oh, I'm not comfortable enough with this topic to train the mentors in it. Is different than I don't want to do it because I'm afraid the mentors are going to have a hard time with it. And so I think we just have to have those conversations. So, it can start very lightweight with just, there's videos on YouTube about trauma-informed care, and just say, hey, you guys want to watch this? You can do more in-depth trainings, which we're happy to support you on. Things like that. But I think it's just getting them the information as much as you can and having those conversations and, using the language, right? And then the other piece is also with the mentors, but also thinking about from our programmatic perspective, right? Within our program operations, are we doing things that are, trauma informed, right? Do we have our program materials in multiple languages? Do we do we have policies that, and, programs and systems in place that support, transgender youth or non-binary youth? Do we have things in place to support young people who might not have a stable address? Or how do we support young people whose parents are incarcerated or, leave for periods of time because they're in active drug use? Things like that. Do we have those systems in place that allow these young people to access our programs and systems? And so thinking about and changing some of that framework from, are systems in place because it's the easiest way for us to get things done, or are systems in place because it's the best way to get young people involved in our program? And so that's just the other way you want to think about trauma-informed care. We can think about it in that very micro perspective of the mentor-mentee relationship, but it's also on a very meso-macro perspective where we're looking at how our organizational systems and policies are set up to create pathways, avenues, and systems that promote and support young people. Cool. Well, if you have any other questions, I will reach out with an email by the end of the week with the slides and some resources, and you can feel free to reach out, and we can offer you any other specific questions, support you may need. I'll be happy to connect and offer any specific resources that we can. We do offer individualized training and consulting directly for mentoring programs, and so we're happy to offer those supports to you if you want to reach out and inquire. I appreciate everyone coming out today. I hope you enjoy the rest of your week and have a happy Wednesday. Thanks, everyone.